COVID-19 cases are rising back up, but as WDRB's Travis Ragsdale tells us, some experts say that number isn't the best way to track the pandemic.
Charts, and more charts. Case counts, deaths, vaccine rates. The COVID pandemic has led many to constantly refresh screens, trying to find the latest numbers on COVID case counts. But
case counts is difficult because we have surveillance bias.
Case counts may not be the most reliable way to tell how the virus is progressing, at least not anymore.
The average person maybe who's vaccinated, or those that aren't, for whatever reason, in one way or another, may not go in to be checked if they're not really profoundly ill.
Consider this. The Institute for Health Metrics and Evaluation estimates that in the first 6 months of the pandemic, there were more than 17 million cases of COVID that went undiagnosed. And as more people have been vaccinated, some doctors say it's better to look at hospitalizations and deaths as an indicator for the virus.
The ones we do know are those of people that were sick enough to be admitted. Those are like hard and fast numbers.
And while case counts are trending up right now, deaths and hospitalizations are not. In Louisville, hospitalizations have been largely flat since October. Deaths are down to their lowest level since the summer. Last week, just 2 people died from COVID in Louisville. Still, though, doctors say the vast majority of those dying and in the hospital with COVID are unvaccinated.
For anyone who's arguing, well, people who are vaccinated are getting it and can spread it, that's not wrong. But the fact of the matter is that profoundly different numbers of those who are not vaccinated are getting sick and dying.
Travis Ragsdale, WDRB News.